Ever wondered how aging affects your body in ways you might not expect in this video? We uncover 10 surprising transformations that happen to the male body, specifically the penis after age 70. And most importantly, how you can take action to prevent or manage these changes. Don't let aging catch you off guard. Learn the proactive steps to maintain your health, confidence, and vitality. I'll share safe and effective alternatives that can help you strengthen your erections and preserve your intimate health, promoting a satisfying and active sexual life. Before we proceed, make sure you're subscribed to the channel to keep up with our videos on sexuality and relationships. If you found this content helpful, give it a like. It helps us reach more people. Comment 1 if you found the topic interesting, or 0 if not, so we can improve our content. First, change excess skin as we age. Especially after 70, our bodies show natural signs of time passing, and one of these is excess skin on the penis. This happens because over time the skin loses its ability to stretch and return to its original state. Moreover, essential substances like collagen and elastin-1 decrease in size. Causes and prevention, which keep the skin firm and resilient, start to decrease. The penis, which used to have tighter skin, may now appear to have slightly looser skin. This difference can surprise some men, as the appearance may, in some cases, resemble phosis, a condition where the foreskin does not fully retract. However, it's essential to understand that this does not mean you have phosis. It's simply that the skin has become looser due to aging. This loss of skin firmness does not happen only on the penis. Parts like the face, neck, and hands also lose elasticity and become more flayed over the years on the penis. This change may be more noticeable as the naturally tense skin in this area begins to relax. For some men, this aesthetic change can cause a degree of discomfort, but it's important to remember that it's part of aging. Generally, it doesn't affect sexual function or the ability to have erections, though a bit more hygiene care might be necessary to avoid irritation. If this change causes discomfort, there are options to improve skin elasticity, such as creams and specific treatments. However, many men choose to accept this transformation, recognizing that the body goes through different phases over a lifetime, and each one is part of our story to support a fuller and more. 2. Reduced sensitivity. How it happens and what to do about it. Satisfying sex life. I've made available the digital book, Rediscovering Intimacy, Healthy Sexuality After 60. It includes practical tips to strengthen your relationship, overcoming emotional and physical challenges with solutions that rekindle passion and connection. Get your copy in the pinned comment and take this opportunity to transform your love life. Second change, loss of elasticity. Over the years, the body changes in many ways, and one of these is the skin on the penis, which begins to lose its natural elasticity. This happens because collagen and elastin, substances that make the skin firm and flexible, diminish over time. When we're young, the skin on the penis stretches easily and feels firmer during an erection, but as we age, this ability to stretch and return to normal diminishes. So during an erection, the penis may feel less firm, and even to the touch, it may feel different. This is something many men notice, and while it doesn't change function, Alice, it can cause discomfort or concern. Besides the skin, the internal tissues also lose some elasticity. As a result, the rigidity the penis used to have may no longer be the same, though erections still occur, and this difference isn't only evident during an erection when the penis is at 3. Changes in blood flow. Impact on erections and circulation. Tips. Rest. The skin may appear looser, and it may not look as taut as before. Despite these changes, sexual function remains intact. Erections still happen, even if the rigidity isn't what it was in younger days. For those who want to improve skin elasticity, treatments with creams or collagen stimulating therapies are available, but many men accept these transformations as part of life and aging. Third change, reduction in size and thickness as the years go by. It's common for many men to notice a slight reduction in the size and width of the penis. This change is linked to aging and occurs mainly because of reduced blood circulation. As we age, blood flow to the penis may become less efficient. The arteries that carry blood to the area can narrow due to fat buildup on the walls, making circulation more difficult with less blood reaching the penis. Erections may appear less full, causing the sensation of reduced size and thickness. Another crucial point is that the tissues that help make the penis firm, the corpus cavernosa, also don't expand as much as they used to with less blood flow. These tissues fill up less, which can reduce firmness and thickness during erections. This is a natural consequence of aging. 4. Testosterone decline. Effects and how to boost naturally and doesn't imply a serious problem to help minimize these effects. Maintaining a healthy lifestyle can make a difference. A diet rich in fruits, vegetables, and circulation-boosting foods is essential. Additionally, regular exercise, especially activities that strengthen the cardiovascular system, helps keep blood flow active and improves general health. Avoiding smoking and excessive alcohol consumption is also essential. Both tobacco and alcohol affect circulation and can amplify the perception of this reduction in penis size and thickness. 4th, change less visible penis. As we age, the body goes through various transformations, and one of these is known as the hidden penis. This effect occurs primarily due to fat buildup in the area above the penis, and scrotal sagging over time. Fat in this area increases, creating a layer around the pubic area, which can make the penis appear hidden and smaller, especially when at rest. Besides the fat, the skin of the scrotum also loses firmness with age. The scrotum, which usually holds the testicles in a higher position, can become looser, enhancing this sense of retraction. The combination of fat buildup around the pubic area and a more fleed scrotum results in a more 5. Skin texture and elasticity. Why it changes and care tips. Retracted appearance for the penis. For those bothered by this change, some options are available. Cosmetic surgeries such as liposuction in the pubic area can help remove excess fat and make the penis more visible again. This procedure is an option for men who want to restore the penis's appearance and feel better about their image. Additionally, treatments aimed at improving scrotal firmness are also available. These procedures help tone the skin and lift the scrotum, contributing to a less retracted and more natural appearance of the penis. 5th, change calcification in the penis. Over the years, certain changes may occur in the body, and one of these is penile calcification, a condition more common in older men. This process can be related to a condition called Peyronie disease, where hardened plaques form inside the penis, specifically in the corpus cavernosa, the structure that assists in erections in Peyronie's disease. These plaques develop due to chronic inflammation over time. This inflammation leads to calcium buildup and scar formation, creating rigid areas that can make the penis less flexible. This rigidity can cause the penis to start curving, especially during erections, which may be uncomfortable or 6. Increased risk of ED, causes and ways to manage. Even painful for some men. This calcification reduces the penis's ability to expand naturally during an erection. Typically, the corpus cavernosa fill with blood, allowing for a firm erection. But with these hardened plaques, expansion is limited, making it difficult to achieve a complete erection and causing deformities. Besides Peyronie's disease, other factors such as repeated trauma in the area can contribute to this calcification. Small injuries caused by intense physical activities or even strain during sexual relations can lead to scarring, which can harden over time. Men experiencing this condition should seek medical guidance. Treatment depends on the severity of the situation. In milder cases, medications may help reduce inflammation and increase tissue flexibility. In more severe cases, surgery may be necessary to remove calcium-eyed plaques and correct the curvature. Sixth change, reduce natural lubrication. As the years go by, many men notice that the penis doesn't remain as hydrated as before. The skin begins to dry out as it produces fewer substances that maintain moisture and elasticity. This dryness occurs because the skin throughout the body gradually seventh curvature, Peyronie's disease. Explanation and possible treatments loses its ability to retain water over time, thus with less sebum and natural moisture. The penis may feel dire during sex. This lack of lubrication can increase friction and cause discomfort, even possibly irritating the skin. Dryness affects not only comfort but can also interfere with erection, since less flexible, drier skin can hinder the natural movement of the penis. During intercourse, this can decrease pleasure, making the experience less satisfying. To address this issue, using lubricants is a practical and effective solution. Water-based lubricants are a good choice, as they are gentle and help reduce friction, making everything more comfortable and protecting the skin. Another option is to use specific moisturizers for the genital area, which can restore moisture and relieve dryness. Gentle products without fragrances or irritating substances are ideal to avoid any extra discomfort. Seventh, change appearance of spots as we age. It's normal for the skin of the penis, like the rest of the body, to start showing spots and changes in color. These marks appear naturally over time and are the result of changes that occur in the skin as we get older. Over the years, the skin loses its ability to renew itself. 8. Slower. Arousal. Response. How arousal changes and coping strategies and maintain a uniform appearance. This happens because the production of collagen and elastin substances that keep the skin firm and elastic decreases. Without this support, the skin can start to show darker spots due to increased melanin or lighter areas due to reduced pigmentation. In addition to aging, external factors like sun exposure and pollution also contribute to the appearance of these spots. Although the skin of the penis is generally not exposed to the sun, internal changes such as hormonal fluctuations and slower circulation can promote the appearance of these marks. In most cases, these spots are not dangerous. However, it's always a good idea to be alert to any sudden changes or discomfort, such as itching or pain. If you notice anything unusual or concerning, it's important to seek medical guidance, as some spots may indicate infections or specific skin issues. To keep the skin healthy and reduce the appearance of spots, it's helpful to care for it with gentle moisturizing products, avoiding irritating substances and protecting the skin from factors that can dry it out or alter its color. Also helps maintain a more uniform and healthy appearance. 8th, change small cracks. As the body ages, the skin of the penis may become 9. Shrinkage of testicles. Why it happens and affects drier, making it easier for small cracks or fissures to appear. This happens because over time, the skin loses its ability to retain moisture and flexibility, becoming more fragile and susceptible to damage. As we get older, the skin produces less sebum and other substances that help keep it hydrated and soft. This loss of moisture makes the skin drier and less resilient, which can lead to cracks, especially during moments of friction or pressure. Such as sexual activity, these fissures may appear as small lines on the skin and cause discomfort as well as pain when stretched, like during an erection or intimate contact. This discomfort can affect pleasure and the quality of sexual life, reducing overall well-being. In addition to causing pain, these cracks can also be a health risk, as they allow germs and bacteria to enter, increasing the risk of infection. Therefore, keeping the skin hydrated and healthy is important to prevent these small lesions and avoid future complications. 9th, change, reduction in penis length. With aging, some men may notice that the penis appears smaller than before. This happens due to a combination of factors that become more evident with the passing of years. Blood circulation in the genital 10. Changes in color, causes, and what it indicates area may decrease, preventing the penis from fully expanding during an erection, which gives the impression of reduced size. Another reason is the accumulation of fat in the area above the penis. As the body accumulates fat in this region, part of the penis may seem hidden, giving the impression that it is shorter. This effect is even more common in people who gain weight over time. Additionally, the tissue of the penis itself may undergo changes over time. The structure that gives the penis its volume may alter, making it appear less full. These transformations are part of the aging process and reflect the natural functioning of the body. While these changes are natural, there are ways to mitigate them. Keeping weight under control can help reduce fat accumulation around the pubic area, while regular exercise helps maintain good circulation. Engaging in activities that strengthen the pelvic muscles also contributes to better sexual health and can help preserve erectile function. 10th change, reduce sensitivity as the years go by. It's common for many men to notice a decrease in penis sensitivity, especially if they face chronic conditions like high blood pressure. Or preventative tips: how to minimize or avoid these changes. Diabetes. These conditions can affect both the nerves and circulation, reducing the response to stimuli. High blood pressure can damage blood vessels, reducing blood flow to the penis and hindering the appropriate response to stimuli in the case of diabetes. High blood sugar levels can cause nerve damage, a condition known as diabetic neuropathy, which reduces sensitivity in various parts of the body, including the penis, with reduced sensitivity. The response to sexual stimuli may weaken, making pleasure and satisfaction during sex less intense. This change can make reaching orgasm more challenging and impact the quality of sexual life, affecting emotional well-being as well. To minimize this loss of sensitivity, it's essential to manage conditions like hypertension and diabetes. Well, with proper care, the negative effects on sexual sensitivity can be reduced. Consulting a health care professional can also help identify specific treatments such as physical therapies or even medications that contribute to improved sexual function and restore greater sensitivity. It's important to understand that while aging brings natural changes, there are several ways to care for the health and appearance of the penis. Final thoughts. Recap and motivation for staying proactive that help boost self-esteem. In addition to specific treatments such as aesthetic procedures and medications, maintaining a healthy lifestyle is essential. Exercising regularly, having a balanced diet and managing stress make a big difference, helping to reduce signs of aging and promoting a more satisfying and healthy life. Before we conclude, I'd like to know your thoughts on this content. Comment below which of the changes discussed caught your attention the most, or if you've noticed anything similar. This type of feedback is very important, so I can bring you content that's even more aligned with what you're looking for. Don't forget to like the video. Your like is essential for more people to access this information, helping the channel grow and reach other men who need to learn more about their intimate health. Share this content with friends and family. In the end, George realized that aging wasn't something to fear. It was simply a new chapter with its own set of changes and challenges. By facing these transformations head-on and making intentional lifestyle choices, he reclaimed his health and confidence, proving that life beyond 70 could still be fulfilling, active, and deeply rewarding. George learned that he didn't have to accept the limitations that come with age. Instead, he could adapt, evolve, and thrive. His journey showed that with the right mindset, self-care, and resilience, the golden years could be not just lived, but truly enjoyed.